Good day, everyone. I am Luigi Estrada Pamela1, and today I am going to perform assessing the musculoskeletal system. So, muscle, bones, joints, and connective tissues such as tendons and ligaments surrounds the musculoskeletal system or MSK. The musculoskeletal system is often assessed by the nurse for muscular strength, tone, size, and symmetry of muscle growth as well as the tremors. So the purpose of this is that the musculoskeletal examination assists in identifying the functional anatomy linked with the clinical disorders, therefore distinguishing the underlying system implicated and perhaps pointing to the illness, assessing in early diagnosis and intervention. So prior to the conduct of the procedure, I am going to close the door to secure patient's privacy. I'm gonna need to provide an adequate lighting and adjust room temperature for patient's comfort. Okay, then I am going to gather the necessary equipment such as the pen and the documentation record, the goniometer. So I have it here, the goniometer, of course, the pen, and the documentation record. Then I am going also to gather the tape measure. So I have it here, the tape measure, and of course I have the reflex hammer. So now I am going to perform hand hygiene and observe appropriate infection control. This is to prevent the spread of microorganisms. Okay, then I am going to compare bilaterally during assessment. This is to assess thoroughly each side. Okay, so now I am going to introduce myself to my patient and verify his identity and of course explain to him the procedure that I am about to do. Okay, good morning, sir. I am Luigi Estrada, your student nurse for today. May I see your wristband, please? Okay. Please state your complete name and your birthday, please. Okay. So today I am going to assess your musculoskeletal system. Is it okay with you? Okay. Okay, so for the symmetry, contraction, and strength for muscle, I'm going to inspect the muscles for size. Then I'm going to compare the muscles on one side of the body, that is, for example, of the arm, the thigh, and the calf. And at the same time, to the muscle on the other side. This is to check for any discrepancies. Then I'm going to measure the muscles with a tape. Okay, sir. Kindly take your seat. Okay. Okay, so I'm going to use the tape to measure the size. Okay, so 7.1 inches. Okay, let me measure the other side. Okay, so it's the same. Okay, let me measure your legs. Okay, so 12 inches. The other side. Okay, so it's also 12 inches. Okay. Then I am going to measure the calf. Okay. Okay, so it's 11. Okay, it's the same. So both sides have the same measurement. Okay, please take your okay. Then I am going to inspect the muscles and the tendons for contraction. Okay, so let me check your muscle. Okay. Okay, so there's no contractures. Okay, how about your knees? Okay, there's no contractures also or shortening. Okay. That's good. Please relax, sir. Then I am going to inspect the muscles for the femurs, for example, by having the client hold the arms out in front of the body. Okay, sir. Please Take your seat. Okay, please hold up your arms like this. Move forward. Okay. Okay. So please stand it. Okay. So there's no tremors. Okay, that's good, sir. Okay. Okay, so now I am going to test the muscle strength. Okay, sir, please take your seat. Okay. Okay, sir, please turn your head from side and to the, okay. Okay, and move it right here, sir. Okay. Okay, move it, sir. Okay. Okay. More force, sir. Okay. That's good. How about the other side? Okay. Move against my hand. Okay. Okay. That's good, sir. Then there's no problem with that, and I can rate it as 5. I mean the muscle strength is 5. Okay. So now let's go to the trapezius. So that's for the sternocleidomastoid. Okay, now sir, please shrug your shoulder. Okay. Okay. So the strength provided is strong. Okay. So I could rate it as 5. So there is 100% of strength, or there is normal strength. Okay, so now let's go for the deltoid. So for the deltoid, please sir, okay, put your arms up. Okay sir, so you are going to push your arm upward and I am going to push it down. Okay, you should resist it. Okay sir, please. Okay. Okay, so there's strength. Okay. So now let's check for the bicep. Okay, so extend your arm, sir. Okay. Okay, flex it. Okay. Okay, sir. How about the other one? Okay. Okay, so there's the strength. Okay, so the strength provided is good. Okay, sir. Please relax. Please straighten your body. Okay, sir. So now let's go to the triceps. Okay, please extend your arm. Okay. Okay. Okay, sir, please pull it. Okay. Okay, so the first provided is good. I can rate it as 5. Okay, now the other one. Okay, please stand it, sir. Okay. Okay, it's also good. It's normal. Okay, so I could rate it as 5 also. Please straighten your back, sir. Okay, so now let's move to the wrist and the finger. Okay, is it okay with you, sir?
Yes.
Okay. Okay, sir, please spread your fingers. Okay. Okay, sir, please resist it, sir. For example, like this, you should extend it like this. So I'm going to put it together. Okay. Okay. Okay, so the strength provided is good. It's normal. Okay, so the I could rate it as 5. Okay, relax, sir. Okay, so now, sir, hold my fingers. Okay, I am going to interrupt it. Okay. Okay, so the strength provided is good. I could rate it as 5. Okay, how about the other one? Okay. Okay. Okay, that's good. The strength is normal. Okay. Okay, now, sir, I'm going to put you in supine position. Please relax, sir. So now I am going to check for your hip muscles. Okay. Okay, sir. Okay, sir, please extend your leg. This one. Okay, sir, like that. Please straighten it. Okay, it's working, sir. I'm going to hold it down. Should. Okay. Okay, how about the other one? We should put it up, up. Okay. Okay. So the strength is good. Okay, that's fine. I could rate it as 5. Okay, sir. Please raise both of your legs. Okay. Okay. So you are going to put your legs apart like this, and I'm going to close it. Okay, or put it together. Okay, 1 to ready go. Okay. Okay. So my strength is good. Okay. It's fine. Please relax, sir. Okay, now sir, let's move on to the hip abduction. You're going to raise your legs and move it apart, sir, and I am going to pull it together. Okay, sir, please. Okay, 1 to ready go. Okay, that's good, sir. So I could rate it as 5. Okay, now sir, let's move to the hip abduction. So it's the same procedure as the hip abduction, sir, but now instead of putting your knees or spreading your knees, you're going to put or pull your knees together, and I'm going to start it. Okay. Okay, let's start, sir, like that, and I'm going to. Okay. Okay, so the strength is good, it's normal. I could rate it as 5. Okay, so now let's move on to the hamstrings. Okay, so you're going to bend your knees, sir. Okay. Okay, so you should receive, sir. Okay, I am going to straighten your knees, but you are going to let it in a bent position. Okay, 1 to ready go. Okay. Okay, so the strength is good, it's normal. Okay, so now let's move to the quadriceps. Okay, so please relax, sir. Now you can relax. Okay, like that. So in this position, sir. Okay, I am going to flex your knees, and you must remain with this kind of position. Okay. Okay. Okay, so the strength is good, it's normal, the rate as 5. Okay, so now let's move on to the muscles of the ankles and feet. Okay, so you are going to resist my actions. Okay, so I am going to dorsiflex you, and you're going to oppose it. Okay, sir. Okay. Okay, that's good. Okay. Okay, it's fine. I could rate this as 5. So now I'm going to flex it. You are going to oppose it. Okay. Okay, that's good. I can rate this as 5 this time. Okay, so now let's move on to the range of motion. So test active range of motion by asking the client to do the joint movements from the head to toe. So active range of motion is the degree of movement of the patient that can voluntarily achieve in a joint without the assistance. Okay, so for the neck, I'm going to do the procedure by asking the patient first to take his seat. Okay, sir, please take your seat. Okay, and relax, sir. So I'm going to assess your neck, sir. Is that okay with you? Yeah. Okay, please move your head down towards the chin. Okay, like this. Okay, that's good. And up. Okay, from side, and then to the other side. Okay, and bend it laterally like this one, just a little bit of bend. Okay, so now rotate your head, sir, like this. Okay, how about the other side? Okay, that's good. Okay, so now let's move on to the arm and shoulders. Okay, so please move your arm up. Okay, like this. Okay, then back normal. How about the other one? Okay, that's good. You may raise it down. Okay. Okay, so now move your arm forward. Okay, like this. Okay, and extend it. Okay. Okay, that's now good. Okay, how about the other one? Okay, that's good. Move your arm like this. Okay. To the other side. Okay, and the other one. Okay, how about the other? Okay, okay, so that's good. Okay, so now let's move on to the elbows. Okay, so please bend your elbows like this. Okay, and like this one. Okay, and move it back. Okay, how about the other one? Okay, so again, let's test this one. Should put it like this and this one. Okay, how about the other side? Okay, that's good. Okay, so now let's move on to your wrist. Okay, so move your wrist up like this one and down. How about the other side? Okay, okay, so you should put it like this also. Okay, that's good. So now let's move on to the hands and the fingers. Okay, are you still okay, sir? You've been comfortable? Okay, that's good. Okay, so please make a fist. Okay, that's good. And open it again and close and open. Okay, so that's good. Okay, so now bend your fingers. Okay, like this one. Okay, that's good. So you're normal. Okay, so now let's move on to the trunk. But before that, I'm going to ask you, is it okay for you to stand? Okay, that's good. I'm going to assist you now. Okay, please stand up. Okay. Okay, so please bend your toes forward. Okay, like this one. Okay, how about the other one? Okay, bend it backward. Okay, like this one. You should put it like this. Okay, how about the other side? Okay, then bend it from side, like this one. Then to the other side. Okay, how about the other one? Okay, that's good. Okay, turn it to the other side. Okay, how about the other one? That's good. Okay, so now you're going to bend backwards and reach your toes. Okay, like this one. Okay, okay. So your stretch ball, that's good. So now let's move on to the hip and knees. Okay, so you should move it like this, then you should. Okay, okay, okay. Again, please repeat that. Okay, how about the other side? Okay, okay, that's good. So now move your leg from side to side. Okay, like this one. Okay, do it like this one. Okay, then okay, how about the other side? Okay, that's good. Okay, so now let's move on to the ankles and feet. Okay, so I'm going to ask my patient to point his toes up and down. Okay, please point your two. Okay, and up. Okay, how about the other side? Point it and then up. Okay, so then from side and to the side. Okay, how about the other one? Okay, that's good. Okay, so now let's move on to the hip tendon reflexes. So I am going to ask the client to relax and provide support for the extremity to be tested. Okay, so this is to provide for the patient's comfort. Okay, so now I am going to get the reflex hammer. Okay, so now I am going to put my palm on the client's right biceps. Okay, okay. So it is located in the antecubital fossa. Okay, so okay. Okay, that's good. How about the other side? Okay, so I could rate as plus 4 because the maximal activity is achieved to normal. Okay, there is reflex. Okay, so fast reflexes using a percussion hammer, comparing one side of the body with the other to evaluate the symmetry of the response. Okay, so now let's move on to the triceps tendons. Okay, so I am going to ask my client to hang his arm freely. Okay, okay, so I am going to support it. Okay, but I'm going to raise just the other arm. Okay, so I'm going to strike the elbow directly with the pointed end of the hammer. Okay, okay, so there is a response. Okay, how about the other side? Okay, there's also, so I could rate is as plus 2 response because it is normal. Okay, so now let's move on to the brachioradialis tendon. So I'm going to strike the forearm with the hammer about 1 inch above the wrist over the radius. Okay, okay, so there is a response. We have the other side. Okay, there's also second rate is as plus 2 because it is normal. Okay, so now I'm going to move on to the quadriceps reflex. So I'm going to ask the client to sit with his legs hanging over the edge of the table. Then I'm going to strike the tendon just below the patella. Okay, sir, so please sit right here. Okay, okay, and hang your legs. Okay. Okay, so I am now going to strike your below of your patella. Okay, so it's normal. Okay, so it's plus 2 because it's normal. Okay, you can now go back to the position. Okay, so now let's move on to the Achilles reflex. Okay, so please turn your feet in a dorsiflex position, see, like this one. Okay, so I am going now to tap the Achilles tendon with the hammer. Okay, okay, so there is a response. How about the other side? Okay, it's normal, so I can rate it as plus 2. Okay, so Achilles reflex. It is a type of stretch reflex that tests the function of the gastrocnemius muscle and the nerve that supplies it. Okay, so for the plantar reflex, I'm going to stroke the side of the client's foot with a flat object. So Babensky reflex is superficial, so it may be absent in the adults without pathology or the overridden by voluntary control. So normally, all the 5 toes bend downward. This reaction is negative in Babensky. So in an abnormal or positive Babensky response, so the toes spread upwards and the big toe moves upward. Okay, so I'm going to stroke it now. Okay, sir, please relax the toes. Okay. Okay, it's normal. Okay, that's good. Okay. So now I'm going to document the findings in the client's record using the forms or checklist supplemented by the narrative notes when appropriate. So this is for legal purposes and for future references. Okay, so I'm going to document it now. Okay. may now relax, sir. Okay. Then, report deviation from the expected or normal findings to the primary care provider. So this is to provide immediate care for the given deviations. And we have to remember that what is not written is not done. Thank you for listening, and thank you, sir.